of practice information session, and we thank you for taking the time to join us today. Next slide. Our whole family approach team here. Tiffany Marley, our Senior Vice President of Practice Transformation. Jennifer Gregory, our Director of Mobility, Learning, Design, and Practice. Jeannie Chaffin, she is the Special Advisor to our team. Myself, Tamaritis Hollywood, Senior Associate of Learning and Dissemination. Katie Smith, Program Associate of Communication and Dissemination. And Denise Drake, who is our Administrative Coordinator for this team. We're happy to be here with you today. And our agenda, we'll start with the whole family approach overview, then read on to the new community of practice opportunity. We'll speak to the application process and timeline. And of course, at the end, we will have time for question and answers. And I believe on the next slide, we have Jeannie, who will be walking us through whole family approach basics.
Thanks, Tamaritis. Happy to be here with all of you today. And let us know where you're joining from. Throw that in the chat if you have a minute or have access to the chat feature. Before we dive in and talk about this opportunity, we wanted to make sure and just cover a little bit of ground that might answer some basic questions about whole family approach. That's a term people hear a lot. They might also hear the term two-generation. These are really concepts that engage both parents and children intentionally and intensively. So we're just going to talk about that for a minute, and happy to answer any questions. Throw your questions in the chat, or we can pause as we move through. Let's look at the first slide that we have here for you today. And it's sort of getting at the why of whole family, not just doing whole family for whole family approach's sake, but really thinking about this as an intervention that helps families achieve social and economic mobility, or to help families reach their full potential. We're really focused here on breaking the cycle of poverty for families from one generation to the next. And we know that that can mean economic mobility, which is really about income and economic status and sort of where folks fall in the social and economic strata. Or it can mean more than that, really about social mobility, which is really other aspects other than income, things like feeling like you can make decisions in your life, like you have autonomy and power to influence the future, being valued, or feeling like you can contribute. And so there are aspects of social and economic mobility that go well beyond income. And whole family approach is really a helpful intervention to try to get at those. So sort of the why any organization would be pursuing a whole family approach really gets at social and economic mobility as the North Star, as the vision, as the goal that we're trying to help folks move to. Next slide, please. So there are some kind of major concepts or drivers that are feeding a whole family approach, and we want to talk about those for just a minute. And the idea here is that we have oftentimes focused on adverse childhood experiences when we're talking about families and children. And that could be a family experience where there may be some substance abuse or some physical, emotional neglect. There's a whole series of adverse childhood experiences that have been established to kind of have a negative impact on children so that their adult outcomes are maybe not as good as they could be. But this work here that we're highlighting really tries to make the point that we really ought to be talking about a pair of ACEs or a pair of adverse childhood experiences. We should also be thinking about the adverse community environments that are out there. And poverty is certainly one of those, discrimination, violence. And so it's not just about what's happening at the individual level, but also what's happening in the community. At the community level, sometimes we say that these, in this case, negative aspects in an environment can get under the skin and really influence people throughout their whole life cycle. And so they're calling that the pair of ACEs. And we sort of highlight it here to sort of frame up that social and economic mobility really requires that we think about both individuals and community, or the environment and people's experiences. And what we're really striving to do is, on the next slide, is really to create resilience and help people thrive and flourish and create thriving places, which will create thriving people. And you sort of just have this great positive cycle to build resilience and sort of help to create help people create their full potential, right? And so in that first slide, you can imagine there's fear, the flight or flight experience may be triggered. Whereas in this model here, when we are in the resilience and flourishing, people have what they need to really flourish and grow and create a growth mindset. And so again, individuals and communities, it can, be a negative or it can be a positive. And so how do we create positive experiences and environments for people to grow and learn and advance in? So that's sort of one concept that we want to bring into our discussion about whole family approach. Let's look at the next. And what this is going to require to sort of get to this level, right, where we really build resilience and help achieve social and economic mobility, is engaging families, really looking at the data and being data driven, but also person centered. And I'm going to talk in a minute about the domains that kind of make up whole family. And we have to be person centered, which we have to really meet families where they are. That's going to be a big requirement here. And so as we're sort of talking about those environments, you saw discrimination, really thinking about equity and starting with racial equity in all that we do in this approach, addressing all those other community factors that you saw there in the pair of ACEs, and really being committed to innovation and sort of looking at what works and being data driven and continuing what works. But if it's not working, looking for other possibilities, right? So part of whole family is really leaning into these areas. And we'll talk a little bit more about that in a minute in some other slides. Let's look at the next one. So you might be coming to this conversation. Maybe somebody asked you to, hey, go see what that learning community is about. And maybe you've heard the term whole family approach. Maybe you've heard the term two generation. It's not necessarily a new term. It's kind of been around for a while. And we want to just put it in some context here, right? So maybe your organization operates Head Start, and Head Start has been around since the summer of 1965. And from its earliest days, Head Start definitely was a concept where you're serving both parents and children. We often say that Head Start is the gold standard of early childhood education. And depending on what kind of intentionality and focus your particular organization may be bringing, your parent component of Head Start might be pretty robust too. Oftentimes, though, in Head Start, the caseloads are pretty big, and depending on what kind of model, whether you're serving 4-year-olds or 0 to 5, the duration of Head Start maybe not be quite enough to do some of the things that we're talking about in whole family approach today. But in many ways, Head Start was the original two-gen or whole family approach model. In the 1990s, the Foundation for Child Development started, they really coined the term two generation, and many of the efforts that kind of were started in the 1990s are kind of known as two generation 1.0. And what was really happening here was people said, maybe we ought to bring early childhood into some workforce programs that we have, or vice versa. So like trying to think about how do we make sure and pay attention to early childhood and workforce education, employment. Some of those programs were not measuring both very well. Some of them were not intense enough to really move the needle for both parents and children. And then about 1996, welfare reform came about, and that sort of really made everybody think very hard about work, and everybody started emphasizing work and getting people off of TANF. And so some of those two generation 2.0 was not quite as successful as everybody had hoped. And then in the early 2000s, which a lot of people think about this as two generation 2.0, there was several different philanthropies, the Annie E. Casey Foundation, the Kellogg Foundation, the Kaiser Family Health Foundation. And Kaiser really leaned into working with the Community Action Program in Tulsa, and they started thinking, let's get really intentional and intense about both the child component and the parent component. Let's measure both. Let's serve families with a duration and an intensity that's really needed to achieve social and economic mobility, or as some would say, break the cycle of poverty from one generation to the next. And so it's sort of changed over time. And people have built whole family approach or two generation on different platforms. And so we certainly can answer some of those questions if you have them here. It can look different ways in different places. But let's talk a little bit more about whole family approach today. So on the next slide, we sort of are trying to help you maybe think about and notice we say two generation and whole family. And I just want to I just want to stop and call out that we understand that families define themselves, and you might have an auntie raising some other young family members, or even foster parents. So there's a lot of different ways families can look, and nobody here is trying to dictate that or message a certain type of family. But we are talking about parents, so adults or caretakers, and children. And different programs target different ages of children. Sometimes it's just 0 to 3 or 0 to 5 or 0 to 12. It can really be different. And of course, adults can have different ages of adults. And those interventions, in some places, you may have at your agency some very focused adult, like Workforce Investment Act for adults. That is a very adult focused program. And maybe you have some child focused programs, or maybe like Head Start, it's child focused, but there is some adult, right? And so there you can be offering services on this continuum. And some things are kind of what we might call family, like Section 8 or parents as teachers. And so it's sort of pulling these things together and serving both parents and children that really creates our whole family approach. So you might just think at your agency, what kind of mix, where are we at? Do we have some things that are already whole family, or do we have a lot of adult focused programs and no child focused programs? And so that may help you think a little bit about this. Let's get the next slide. So I mentioned being person-centered earlier, right? And sort of why we say you have to be person-centered is that families really may need support in any of these domains, right? Like some families may really need some mental health or health, but they're really doing find in the social capital space, or maybe mom or dad or auntie really needs some post-secondary and employment support. Maybe they need some training or some work or some on-the-job training so that they can make an income that's a family supporting wage, right? To break that cycle of poverty. Or maybe some of the kids really need some K through 12 early childhood. Usually no family needs all of this, right? Because families all have strengths, but we don't know until a family sort of comes in and we start working with them. And so we have to be able to coordinate a really robust mix of these kinds of domains or components in order to be whole family. And that doesn't mean you, as your organization that showed up today from Minnesota or North Dakota, have to operate or provide every one of these domains and things that are in each of these domains, right? But you need to be able to build partnerships and collaborate with others. So, for example, maybe if your organization is not the Head Start provider, right, you might need to collaborate with the Head Start provider in your community in order to have a robust early childhood component in your whole family mix. And so, really being able to customize based on what families need, and some tools that are often used for that person-centered customized approach are like family assessments, goal planning, goal setting, coaching. We see a lot of coaching in whole family that sort of tries to help arrange this person-centered approach for each family over the duration, the time that they need to meet their goals and really achieve their full potential, break the cycle of poverty from one generation to the next. Okay, let's look at the next slide, please. So this is a little slide that the partnership has put together, and over here on the right are sort of what we call the hallmarks of a two-gen or whole family approach, and that's a little bit longer list, right? And it's a little bit more detailed. So integrating services, that is really a part of whole family. You can integrate services for a much wider population, veterans, seniors, many different kinds of populations, but certainly when you're doing whole family, you need to integrate services, make service coordination easy for parents and children. As I mentioned, developing partnerships, centering in equity. There's kind of a list there. We do not call this a checklist. We call this hallmarks of whole family approach, right? But there are over on the left a few really key concepts that if these things are not present, then you may be doing some really great work. It may be very important work, but it probably should not be called whole family approach or two generation. We start in these key concepts by saying whole family is not a cookie cutter or a checklist, right? Every community needs, different things based on what's available and the unique conditions in that community. So it's not a cookie cutter, but you got to be serving parents and children together at the same time, same parent, same child in the family, not, oh, we have kids over here and parents over here that aren't connected. Parents and children together, which that probably means you're like goal setting and planning for the whole family, right? For parents and children. And we're really pointed to those social and economic mobility outcomes or breaking the cycle of poverty, right? This isn't just a little bit of improvement for families. It's like really helping them to get a family supporting income and get out of poverty. So that has to be present. And then services and supports and interventions of sufficient intensity, duration, and quality. So you've probably already noticed that I've talked a lot throughout this What is Whole Family about intensity, duration, and quality, because the reality is to get the kind of outcomes that are we're looking for with social and economic mobility, it's got to be sufficient. That doesn't happen in a month or two, maybe even 3 months, right? It might take a year, 2 years, 3 years. So that's what we mean by duration, is how long can you work with the family? That's kind of another example of sometimes Head Start is a great platform to build on, but even Head Start might not be enough duration, right, to really be whole family. It might be part of a larger coordination of things. So let's just talk about a couple more things, and then hopefully this is like giving you a really good aha. I understand things a little better than I thought, or I've misunderstood some of this, and so this is very helpful. Let's look at the next slide. So you'll notice we talk about whole family approach and two-generation approach, right? We don't say program, we don't talk about a single service, and that's very, very intentional. Whole family is integrated, and it's more than just a program, right? And it can be a couple different things. It can be a mindset. Like you can bring a two-generation whole family approach mindset to almost anything you're doing. So a great whole family approach uh, operator that I know, they brought whole family approach to summer feeding, in that they don't just feed children, they feed the whole family in their summer feeding program, and they provide other interventions. So that's kind of a mindset, a new way of thinking, like we're not just going to feed the kids, but we're going to feed everybody. But that's probably not of sufficient duration and dosage in and of itself to be a whole family, right? So thinking about also, you can have a whole family approach strategy where you're really aligning and coordinating a rich quality mix of services, probably collaborating with others. And that's sort of a strategy, a whole family approach strategy. And then you might be a whole family approach organization where you're really providing services and supports to both children and adults simultaneously, and really tracking those outcomes for everybody in the household across the whole organization and across all the family. Not one of these, it's not that you sort of necessarily have to move through this. You could sort of be at different places on this continuum in different parts of your organization, or in different times during your journey, because whole family approach really is a journey. But we just want to emphasize that we're not just looking for a little boutique program that you kind of say, we're serving 10 families in a whole family approach, right? And it's this little program. That might be a pilot, and that's okay. Pilots are good to learn, but we're really looking for an approach here that sort of moves your organization, your strategy, the mindset in a little bit different way. We also have some communities that are trying to be whole family approach, two-generation communities, which is a whole nother thing to talk about. All right, let's look at this. I think getting close to the last sort of what it is slide. We just want to mention to you that this whole family approach isn't just the flavor of the day. As you saw, it sort of has been around for a while, and it's gone through different iterations, and all of the latest science is really informing what we think whole family is today in the field. And you've seen that several of the slides that we have highlighted have given attribution to Ascend at the Aspen Institute, which is really a hub for two-generation thinking. And they're continually monitoring different kinds of research about what works for children and what works for parents. And when we talk about serving parents and children together, we talk about early care education, or really getting parents a family supporting wage, that's all driven by different pieces of evidence and science, whether it's things like a college degree doubles a parent's income, or whether it's an idea, the very last item there, that, unconditional cash aid may given to families with newborns may increase infant brain activity. And so some of these items here are probably not a surprise to you, but just making sure that you understand that, there's some key points here about serving folks early. So let's look at the next slide. Now, we're going to go ahead and talk about the community of practice, I was thinking there was a slide here that gave a good example. I can't remember sometimes which slides we've included and which ones we haven't. But on the science part, when you think about the science, the whole idea that shortening the spell of poverty for a child will help them to have better health and wellness outcomes as adults. And so things like this science sort of point us in, let's try to shorten the spell of poverty for that child, get the parents' income up above 200% of poverty, for example, get that family out so that that child can hopefully have better outcomes later. So that kind of science is informing the whole family approach. And if you're really trying to do what works, so that you can have the impact that you need, then whole family approach might be the right approach for you to think about. And Jennifer, I think, is going to talk to you about joining the community of practice to help you learn more.
Thank you, Jeannie, for giving us a foundational overview of what whole family approach is and how we are seeing it applied in community action agencies and community-based organizations across the country. Before we move into a brief overview of this community of practice opportunity, I do want to pause to see if there are any questions for Jeannie from our guest. If there are, please drop them into the chat or the Q&A, and we're happy to answer those before we wrap up today. We also want to let you know that if you're intrigued now, or if we've refreshed, rekindled some interest in you about whole family approach, NCAP is launching a 3-part webinar series on whole family approach starting on April 10th with a whole family approach 101 foundational concepts session on April 10th. And you'll be able to register for that as early as this Friday. Just check out our weekly e-news for that opportunity. And if you're not subscribed to e-news, a quick visit to our website will take care of that for you. So with that, we'll jump into this particular opportunity that we are very excited about. Next slide, please. If you're new to NCAP or to the concept of a community of practice, what is a community of practice? It is the best analogy I've been able to come up with is think about when you were in college and you had lecture series, but then you may also have had an accompanying lab and then a study group and also some experiential learning and maybe even some on-the-job training. Yes, all of that rolled in together is a community of practice. It is a learning cohort, but it's also a doing cohort where you have the opportunity to engage in hands-on work with the support of NCAP, our cadre of subject matter experts, as well as your peers. This particular community of practice that we're launching later this year will support at least 6 community-based organizations, including tribal governments, in achieving greater results for families and communities by implementing a whole family approach to the way they do business. Next slide, please. So as we said, we'll launch later this year. It is a 2.5-year commitment. So it's not just a one and done or a short-term learning series. As Jeannie mentioned, we recognize that it takes time. It takes duration to realize change in families. And likewise, it takes duration to realize structural and systemic change within organizations and how we approach our work. So we are in this for the long haul, starting in July and wrapping in December of 2026. This opportunity, again, is open to community action agencies, as well as community-based organizations, including tribal governments, serving families in Alaska, Idaho, Minnesota, Montana, North Dakota, South Dakota, Washington, and Wisconsin. For those who may not be within that 8-state footprint who are interested in implementing whole family approach, we encourage you to reach out to NCAP directly. We're happy to discuss your needs and how we might be able to support you in your whole family journey. This particular opportunity is limited to those 8 states because it is grant funded, and that is the 8-state service area of our funder. So we are restricted on geography there. The cost to participate. There is no financial cost to participate, in so much as there is no registration fee or any sort of subscription, tuition that you have to pay for this opportunity. However, there is a sweat equity. There is the cost of staff time and effort to participate in this learning opportunity. Next slide, please. And that's because this is a robust and intensive learning opportunity that tries to meet each organization where they are and help you get the resources and information that you need. Some of the ways that we do that is through monthly peer sharing and learning meetings. Those are all virtual. There will, throughout the 2.5-year duration of this community of practice, be special in-person convenings. When those are scheduled, you will know way in advance, and NCAP will also provide a travel supplement to offset the cost for your staff to travel to those convenings. Participants will also receive customized training and technical assistance. In the Community Action Network, we say, if you've seen one community action agency, you've seen one community action agency. We know that we are also very unique, and that's intended to be that way so that we can be responsive to the communities where we serve. And because we know every organization is different and is approaching this work from a different angle, we will provide customized training and technical assistance to participants in the community of practice, as well as individualized coaching, both from NCAP staff, our cadre, again, of subject matter experts, and our illustrious National Peer Expert Corps. And the Peer Expert Corps is composed of seasoned whole family approach practitioners from within the Community Action Network who have realized real impact and success in their whole family efforts. And finally, members of this community of practice will have available to them resources to help build their staff and organizational capacity, including potential access to subgrants to help offset any financial burden associated with your whole family approach implementation efforts. Next slide, please. So what do you get for all this effort that you are investing into this community of practice? First and foremost, a dedicated space and time to learn from your peers and share best practices. And we have heard from previous community of practice participants that this is invaluable. Organizations hear about whole family approach, they see the impact that it's having in other communities, and they want to implement this approach in their organizations. But as often happens, the urgent is at war with the important when it comes to priorities. And so often we cannot carve out the time to make these strategic changes that allow us to increase our impact. Enrolling in a community of practice shows that you are committed to meeting both internally and with your peers on a regular basis, and we're happy to provide that space for those times of work and reflection. Again, specialized TA and access to just a wide array of subject matter experts. And I know from my experience at NCAP, if there is a challenge that an organization is facing that we don't currently have a subject matter expert on board to help with, we will find someone. You'll also have networking opportunities with local and national funders, again, travel support to attend national NCAP convenings, and enhanced program strategies and improved outcomes. At the end of the day, isn't that what we're all here for? As Jeannie said, to help families realize social and economic mobility and to interrupt the intergenerational cycle of poverty. And whole family approach, while not a silver bullet, is proven as an effective strategy for accelerating social and economic mobility for families. And finally, members of this community of practice will have multiple opportunities to contribute to the national conversation on serving whole families through a multi-generational approach. You heard us mention that our National Peer Corps network is made of seasoned whole family approach practitioners. We've also had members of communities of practice serve as panelists at past convenings. They've been highlight speakers at the National Whole Family Approach Institute, and they also serve as coaches for new organizations who are adopting a whole family approach. So this is an opportunity for your experiences and your point of view to influence how we serve families, both within the Community Action Network and within the human services sector at large. Next slide, please. Again, it's free of financial investment to participate in the community of practice, but we do ask for some sweat equity. So there are some commitments that we're asking participants to make. And if you have reviewed, or when you do review our online application, you'll see that these are reiterated there. Based on NCAP's nearly a decade-long experience of facilitating communities of practice in the whole family approach space, we have found that organizations that can and do make these commitments tend to have better traction and track records for success. So for starters, we're going to ask you to assemble a whole family approach team or work group from among your staff and or community stakeholders. And we'll talk more about that during orientation for participating organizations about what a whole family approach team or work group should look like. But as a general rule, we ask that you have at least one member of executive leadership or a key decision maker on that work group, so that your decisions and your work doesn't get stalled in committee, but there's someone there who has the authority to move them forward. We also will ask you to consider having cross-functional staff members. So up and down and across the organization, Head Start is absolutely a great place to start, but also bring folks in from your weatherization or your housing program, folks who may be frontline at intake or receptionists, all the way up to executive leadership. We want this to truly be a diverse representation of your organization and your community. Again, participating organizations will commit to their monthly peer learning and sharing meetings from July through December of 2026. And we will have a very special kickoff event for this community of practice in Seattle, Washington, as NCAP celebrates the 60th anniversary of Community Action. We'll host a very special pre-con event on August 27th in Seattle. And again, for members of this community of practice, travel support and conference registration will be provided. Next slide, please. We will ask that teams demonstrate a commitment to whole family approach implementation. Remember how I said this is a lecture series, but it's also a lab and also experiential learning. There will be homework assignments for community of practice members. We will expect those organizations to convene their whole family teams outside of those monthly peer sharing and learning calls to put into action the learnings that they've gained through peer sharing and learning. And that will culminate in the development of a whole family approach design plan, which will include a theory of change and logic models, and there will be other activities. And we will expect participating organizations to stay on track with those assignments so we can continue to learn and share together. And that will result in a whole family approach pilot initiative or an agency-wide initiative where you take a small test group and see what does whole family approach implementation look like in our organization. We don't expect you to have it perfected out of the gate, so there is some lab, again, with if we're using that analogy here with our pilot initiatives, but we would ask that organizations participating in this cohort would launch their pilots before June of 2026, because you may recall that this community of practice wraps up in December of 2026. So we do want to have an opportunity for organizations to evaluate their pilots and apply any learnings to the next iteration of their work. We will ask for feedback constantly, because here at NCAP, we believe that feedback is a gift, and your feedback will help inform how we continue to host and facilitate this community of practice. Additionally, we'll ask for some data, both about you and your organization and the families that you're serving during your pilot initiative in particular. And that's because we need that for reporting back to our funding source. We want to be good fiduciary stewards over the resources that are entrusted to us, and we are reporting back not only on your growth as an organization and your impact on the community, but the impact that the whole family approach work is having on the families that you serve. And finally, we mentioned before that there is potential access to subgrants to help support your whole family approach implementation work. And again, to be good stewards over those funds, we will ask organizations to report on the use and the impact of those subgrants. And one more ask that we'll have. Next slide, please. Super excited. I know the team is excited about this new component to this particular community of practice. And that is that we want to engage the expertise of lived experience from the very beginning. So we're asking organizations to identify and engage a parent customer to participate as part of your whole family approach team that will contribute to the design and implementation of your whole family approach work. And for organizations selected to participate in this community of practice, NCAP will definitely offer guidance on how to best recruit and prepare parent customers for this opportunity. Additionally, NCAP will provide direct training and stipends for those customer participants because we believe that our customers, folks with lived experience, should be compensated just as any other subject matter expert would be. And we're really excited to be able to implement this as part of this new community of practice. So that's it for the commitments. I hope that between Jeannie's review of the foundation of whole family approach and the impact that it can have on families, and my short pitch on the benefits of this community of practice, you're all chomping at the bit and ready to go online and start your application. And so I will hand off to Katie, who will speak to us about the timeline process of the application process rather, and the timeline for application submission. Katie?
Thank you, Jennifer. Next slide, please. So who should apply? We encourage applicants from organizations ready to implement a whole family approach. And this can be indicated by these bullet points next. Organizational commitment from both the executive director or CEO, whatever their title may be, and a designated core team responsible for managing the organization's participation in the community of practice. Evidence of robust services or partnerships to support early childhood development services and parent and adult skill workforce services. Evidence of potential to integrate services in the pursuit of a whole family approach, as well as demonstrated ability to track and manage data based on results and outcomes. Vision of organizational policies and systems to enable whole family approach implementation. And lastly, organizations must demonstrate family engagement efforts centered in equity. Next slide, please. And up next, this is just a few key dates to remember. On March 25th, our online application launched. It is open and live now. And on April 25th, the application will close. Finalist interviews will be May 1st through the 10th. And then on May 24th, participants will be announced. June 5th through the 27th, participant introductory meetings with NCAP will be held. And on July 18th, we'll host a kickoff meeting for the community of practice. And August 27th is when the special pre-con at NCAP's annual convention in Seattle, Washington will be held. Next slide. And do you guys have any questions?
It's time for questions. Thank you. So everyone should have the ability now to unmute. If you'd like to speak your questions into the space, you can also use the Q&A function or the chat as well. One question that we've seen in the chat is a lot of folks think Head Start by itself is whole family approach or that coaching is whole family approach. Are you seeing those mindsets? Yes, absolutely. One of the reasons why we think it's important at NCAP for us to reiterate what whole family approach is and why we are reviving the 3-part Whole Family Approach Foundations webinar series later this month is to help folks get a better understanding of what whole family approach is and what it isn't, and how it differs from Head Start and other integrated services that organizations may already be providing. And we hope that each one will teach one. Andrea, I see that you have come off mute. Do you have an additional question?
No, I don't. I'm sorry, Jennifer. I just clicked the button because it said, do you want to unmute? And I was like, sure, I guess. I was with you on Friday, so a lot of my questions on Friday were answered. But I'm really, really interested and I'm excited about all of this information you're sharing. So thank you.
Thank you. Any other questions?
Jennifer, I will ask a question then. In speaking about that Head Start example, how do you address that then? Like if folks think that, what would your advice be in that, I guess, is what I'm asking.
Great question. And again, we go back to those key components where we don't have a checklist for what is whole family and what isn't whole family. There are some key components that are true. And one of those is that our services and interventions should be of a sufficient intensity, quality, dosage, and duration to have a lasting impact or to realize real change for a family. As a former Head Start mom, I am top of the fan list for Head Start. In fact, my Head Start baby graduates from high school in just a few weeks, and so I have a great affinity for Head Start. However, I do realize that Head Start is limited in its duration by its very structure, that children often age out of Head Start before families have been able to realize a significant and impactful change to their situations, and then what becomes of those families. So Head Start is certainly a great place to start. Integrated services is certainly a great place to start. But are we tracking outcomes for parents and children simultaneously? Are we applying the same measure of intensity to serving both parent and child, meeting their needs, giving equal importance to both sides of that equation? And are we doing it of a sufficient duration that allows for real change within a family while we're working with them? Jeannie, would you add anything to that? What you would say to someone who says Head Start is whole family or coaching is whole family?
Yeah. So I think that I put this in the chat, that the design plan work that we do to help people think about what it is they're trying to achieve, what outcomes they're really trying to get to. And in that design plan, we create a theory of change and a logic model. They help to surface some of these discrepancies. So when you start thinking, if you think about the why, like breaking the cycle of poverty from one generation to the next, that takes time. And then you begin to say, oh, well, if we start working with families when the kids are 4, that may not give us enough time to really get the family where the parent has a family supporting wage. So I think that those conversations that you have at the agency level about what it is you're trying to achieve with parents and children and how you're going to achieve that, what interventions you're going to use, can kind of help surface some of those discrepancies. And sort of related, Jennifer, while you were talking, answering that question, another one came in that said, do you need to have an existing focus on young children to participate? And I think you don't necessarily have to have the services at your agency for children. You could partner with somebody, and you, as part of your design planning, you might sort of think about what age children do we want to target in the families that we're serving. But the answer is, at some point, you have to be tracking outcomes for both the parent and the child for it to meet the definition of whole family. So it's not a yes or no answer. It's you can get there, but at some point you do have to get there.
Thank you, Jeannie. And more specifically to this community of practice opportunity, if the question is, do we need to have existing programs and services that benefit young children in order to apply for this opportunity? The short answer is no, because as Jeannie said, you may not have all of the things that a family may need within your organization, but a willingness to reach out into the community and to partner with others so that we can provide holistic service for family is critical to whole family approach. So we don't expect you to come into the community of practice having all of those things already identified. The application will ask you about potential for partnerships within your community, because we do want to go ahead and see that thinking. But again, that is something that happens during the design and implementation process. So don't feel like you need to check all the boxes in order to apply for the opportunity. Any other questions?
Jennifer, this is Andrea again. I have all the questions for you folks. You've been doing this now, and you know that there are hundreds of agencies that are involved with whole family in some capacity or another. What are some of their challenges that folks are seeing? And maybe as I say my question out loud, maybe kind of macro level challenges, because obviously some of those caps are going to be urban, some will be rural. If we've seen one cap, we've seen one cap. But have there been any themes that you've noticed in your tenure? Because one thing I'm noticing is that it's been hard for folks to grasp the concept that it's okay to not write a check. It's okay to not provide financial assistance. Thoughts on that?
Sure, thank you. Great question, Andrea. So you're right. You've seen one cap, you've seen one cap, and challenges vary from urban to suburban, rural, and frontier communities. They also vary depending on the availability of supplemental resources and partners that are available to help support and supplement what your organization can do. I'll say this and then I'll pause, because I know my colleagues have some thoughts on this too. One challenge that is somewhat universal, regardless of the location or size of an organization, it can be the culture shift that is required. Jeannie showed us the 2-gen or the whole family approach spectrum, and how it begins with a mindset. And often we want to get straight into doing the good work. We want to design the plan. We want to implement. We want to roll out. But even the best laid plans can be immaculate, but can falter because plans are executed by people. And if the people who are executing the plan don't fully understand the why of it, it's hard to get them to adopt the how. And so we'll certainly, with this community of practice, work with organizations to do some of that foundational culture building, as well as getting into some change management approaches to help address that particular challenge. Jeannie, Tamaritis, Katie, any other challenges that you would say are common across those implementing whole family?
So I agree completely with you about organizational change. And I think, any change effort, if you've got people on the same page, if there's shared understanding, if there are common goals, common measures, then the change gets easier to implement. And so I think we have seen in places where the ground wasn't laid by agency leadership through what the needs assessment says needs to happen in the strategic plan, that if that buy-in isn't there, when I hear folks say, well, we don't have staff buy-in, I always sort of want to go up the line and sort of see what happened at the agency. Is whole family even in the strategic plan? And I don't just mean the words whole family. I mean, is there a commitment in the strategic plan to break the cycle of poverty, or is the strategic plan all about crisis, reducing, crisis for families? So that I think is exactly right, Jennifer. I think there are other things that we've learned about Oftentimes agencies don't have a robust or sufficient training or education component to help parents increase their income above poverty wages. Or maybe if they don't have Head Start, their early child component or any child component is not strong enough to really have an impact for children, whatever age they might be. And so looking at those kind of components in the agency, again, you don't necessarily have to have all that inside the agency. You can have it with partners. But those are also things that we've learned. We've learned that coaching, in even great coaching, is not enough. It's not sufficient to get the family up and out of poverty. So those are just some other things I would add.
One more thing that I'll add to, just depending on where you are, there may be staff at times that even after all the educating that you've done, they're still not wanting to jump on. They still don't see the bigger picture of why you're wanting to implement this. And I'll say in advance, if you do run into this, I would just strongly recommend and encouraging you to always go back to what Jennifer and Jeannie have already mentioned, which is the why. Why are we doing this?
Thanks, Meredith. Seeing no additional questions in the chat, Denise, if we can put the slides back up, we'll share our contact information. We'll also share that in the chat as well, so that if you're like me and the most brilliant question comes to you as soon as you hit leave the meeting, you will have an opportunity to reach out to any one of us, and we're happy to double back and answer your questions. Additionally, on the next slide, we'll show you that there are some whole family approach resources available open source on NCAP's website. You can scan that QR code there, or you can visit us at www.communityactionpartnership.com, and there you will navigate to the whole family approach page, where you'll find our design plan, building blocks resource guide, as well as some design briefs on other organizations that have implemented whole family approach. Additionally, there are recordings of other past webinars that have been hosted on the topic that you can watch at your discretion. And of course, the application link to the online application for this learning opportunity is there as well. Before we let you go, we want to share a couple of other learning opportunities in case you haven't heard. If we could go back really quickly, Denise, the National Leading Equity Cohort is hosting an information session tomorrow afternoon. And if you are interested in building your muscle in the diversity, equity, belonging, and justice space, we invite you to consider this opportunity. It is a short-term commitment, only a few months, but it is intensive, led by our Senior Vice President of Practice Transformation, Tiffany Marley. And again, if you're interested or think you might be interested, at least attend tomorrow's information session to find out more. And on the next slide, you'll see that we are also open and accepting applicants for the Strategic Planning Accelerator. As of Friday morning, there were 3 spots left in the Strategic Planning Accelerator. So if your organization is currently undergoing strategic planning or intends to embark upon strategic planning sometime later this year, this is the perfect opportunity for you. You can scan that code there to learn more, or of course, you can always reach out to any one of us with questions. And with that, I think we are at the end. We want to thank you all for taking time out of your day. I know for some of you it's afternoon, some it's morning. For all of us, it's Monday. So we appreciate you taking time out of your Monday to learn more about this opportunity, and really hope to see your applications in the application portal very soon. Thanks, everyone. Have a great day. Bye-bye.